Hi Bianca, how are you? My name is Danny. I'm going to be your therapist today. What we're going to do today is a posture assessment. All I'm going to do is assess your posture in 3 different dimensions. I'm going to be using this right here, which is what we call a plumb line. I'm just going to line you with it. You're just going to stand relaxed and comfortable. I'm just going to take some notes, alright? So the first time I want you to do it, I just want you to stand on your side, just as here as close as possible, and just stand there still as I look for you a second, okay? Move forward just a little bit. There you go. The first thing that we're looking for is through the head, is to see the plumb line should intersect with her earlobe and the acromion, which as we notice here, the plumb line does intersect clearly through the earlobe and goes down through the acromion. The acromion is a little bit in front of the plumb line, so we notice that she has some rounded shoulders. And if we keep on going down, the plumb line should intersect the body right through the chest, and the sternum should be right in the midline. And if you could just lift your hand just to double check, we see that it comes clearly through the midline of the body all the way through the hip. In the hip, it should go through the greater trochanter, just a little bit anterior to the knee and to the lateral malleolus. If we come down, we see that right here she does have hyperextension of her knee, and there is some slight plantar flexion, as you can see, that is also being caused by the hyperextension. Alright, the next position I want you to do is just stand straight through the plumb line. Alright, the first thing we realize is everything is very symmetrical. So the plumb line should go top to bottom through the plumb line. So if we see that her head is very straight, along with her shoulders. Her right shoulder is a little bit lower than her left shoulder. Are you right hand dominant?
Left hand.
You're left hand dominant? Okay, so as we see, her dominant hand is a little bit higher than the other shoulder. The plumb line should intersect from the sternum and the side foot process, which as we see clearly goes down. There's no rotations of the hip or the rib cage, and it keeps going down, and also through the femurs we see that they're neutral. We do see some supination of both feet, in which they're a little angled out. The last motion I want you to do is just from the posterior aspect, just flip it around. The same thing, as we see the plumb line should go through the midline of the external occiput, along down the spine, and right between the 2 glutes, it should go right through. We see the same thing, it goes straight through the head. She does have, as we see here, some abducted scapula. If we see that they're folded, they're going in. We did realize that she did have some rounded shoulders, so this could be something that could be affecting it. Her scapulas, as we feel here on the inferior angles, are both about equal distance. The same thing as we go down and we check the hips. I'm just going to go ahead and put my hands on your hips. Is that okay? We see that they're both equal, and we keep coming down. We do notice some genuvarum on the legs, as we notice that the femur goes midline towards the body, and then with the distal leg also comes back out. And this is also common with hyperextended knees. So we did realize that when we did the lateral aspect, that she did have hyperextension of the knee. And we also notice some eversion on the foot if we see that the ankle and the calcaneus go inverted a little bit. So this is something that we have to check also in the posture. But a couple of the main things, you can go ahead and just relax, that I realize in your posture is the hyperextension in the knees, your rounded shoulders, and your genuvarum. So I'm just going to give you 3 exercises and stretches that could go ahead and help your posture, to see if we could get your posture to as best as we can, because good posture keeps everything in balance and keeps your muscles from working the least amount as possible to keep your body stable. So the first one that I want to work on is your back. Since we did notice that your shoulders and your scapula were abducted a little bit, and which means that they're just rounded, they're leaning forward, and we also notice that your shoulders are a little bit rounded. We just want to strengthen those muscles. So one of the exercises that I want you to do is we're going to use This is going to implement a TheraBand. It's not a natural TheraBand due to home circumstances. What you're going to do is, it's very simple. I just want you to sit down. You're going to bring the TheraBand around your legs, and you're just going to pinch your scapula. You're going to bring it back, and you hold this. I want you to do this about 10 to 12 times, about 3 sets, and you could usually do about 2 or 3 times a day whenever you find some time. So you're just literally going to bring it in, you're going to pinch, hold it for a second, bring it back down. So I want you to go ahead and try it. I'm just going to stand behind you and just give you a point. I'm going to put my hand right between your spine. Just pinch my finger. There you go. Good job. One more time. Again. Good job. So that's going to help you strengthen your back muscles, which might be somewhat weak, which might be causing you to lean forward a little bit. And it'll strengthen your back, which hopefully would bring out your posture. And then go ahead and just give me this. And then for your hyperextension of the knees, usually is associated with tight quads and weak hammies. So another exercise that I would like you to do, just go ahead and move your hand, stand up, is to strengthen your hamstrings. What we could use is I'm going to use an ankle weight, which is what we're just going to use is just a regular exercise. Just go ahead and put the ankle weight on, right? Find yourself somewhere where you can keep yourself in balance, and just go ahead and just contract the hammy, just like that. Do the same thing about 10 to 12 times to strengthen the hamstrings and make sure everything goes well. We'll just go ahead, just do it for me. Go ahead. Sorry. Good job. Same thing, you're going to do both legs bilaterally. So we'll just go ahead and double check the other leg. Go ahead. And obviously, as we go on and we go strengthening the muscles and everything like that, we will go increasing the ankle weight. This is obviously a relatively light weight. So as we get stronger, we're just going to want to increase the weight. And then the last thing I want to do with you is a stretch, and it's to help out your hip medial rotators, which is your glutes, which as you notice when the Jerry Verum, something very common is your hip rotators get tight, so you might want to stretch them to bring your hip back out to medial rotation. And then I like to call it the pretzel stretch. Very simple. We're just going to go ahead, I'm going to demonstrate it for you. We're going to sit down, right? And you're just going to grab one leg, put it on top of your knee, and just going to lean forward. Just like that. This will help stretch your medial rotators, and then what's going to do there, it's going to stretch your glutes, which hopefully will help rotate back your hips. You want to do both legs. I would say about 30 seconds is the normal time that I want you to do it, the minimum. And if you can hold it a little bit longer, between 30 seconds to a minute. And then what this would do is it'll stretch everything out. And then after that, between your strengthening and everything, hopefully we can get your posture back to the best alignment as we can. Alright? So go ahead and stand up. Is there any other questions that you want to know? Did you understand everything clearly?
Yes, thank you.
Alright, thank you.